The fight against coronavirus is expected to receive a boost as health officials in the Ashanti region welcome real-time data on the pandemic. Now, it follows completion of backlog of samples for testing at the Kumasi Center for Collaborative Research. Regional Health Director Dr. Emmanuel Tinkrang says the development addresses difficulty about the absence of real-time data due to uncleared samples in laboratories. He told a news conference in the Ashanti Regional Capital that Kumasi health officials will now be adequately equipped with the right sort of information on the pandemic.
Until now, the Kumasi Center for Collaborative Research has been the only biosafety level 3 laboratory for the northern sector. Despite staff running 24-hour service, there was always backlog of cases to be cleared. At least 8,000 samples, which have been outstanding, were cleared as at Wednesday. Dr. Emmanuel Tinkrang says it is welcome news.
We were working basically on how to get a real-time data for all the cases. What we realized is that because of the challenges we had, the number of cases that were at the laboratories, we had a lot of backlog at the laboratories. And for that reason, we were not getting the real-time data. So now, with the support of the labs, we've been able to clear a lot of backlog. As at now, Kumasi Center for Collaborative Research have worked so hard, they've been able to clear the backlog. So from now, our hope is that we'll get a real-time data. Because if we don't get a real-time data, then the case management becomes very difficult. In the sense that maybe when you take a sample today, and you don't get the results as early as possible, that person may infect so many people by the time the result comes as positive. So now the focus is to get a real-time data or real-time information so as to know who to isolate and then who to discharge as far as you are a suspected case. So far, we've been able to work with the labs. It's our plan to decentralize the labs. So apart from Kumasi Center for Collaborative Research, we are also working with Ghana Health Service to set up at least 2 labs in addition to KKCR. One will be based in our public health reference lab in Kumasi South. And then we're also talking to Kofanochi to see whether we can use their lab. There are other facilities that is in Kumasi that we can put in shape. Example is the Hope Exchange Hospital.
Despite the success chalked, health authorities have another hurdle to clear, that is stigmatization. They have had to rely on security agencies to protect contact tracers who have always come under attack. Dr. Emmanuel Tinkrang wants all hands on deck to fight this new enemy, stigmatization.
One thing that we want you to do for us is to address the issue of stigma and discrimination. People who go through the protocol and then are discharged, when they go home, they are usually faced with challenges. Anytime we are going to pick a case, there's always a fight. And some of them do not understand, and they resort to social media to discredit what we are doing. We are doing it in your interest. Everybody is fighting together in this country. We need a lot of cooperation as far as the fight against COVID-19 is concerned.
From Kumasi, Ohimi Interior reporting.